This is Talk Business and Politics with Roby Brock.
And welcome to today's Talk Business and Politics. I'm Roby Brock. We appreciate you joining us. I'm joined by Dr. Chad Rodgers and Dr. Jennifer Dillaha. Thank you both for being with us today.
Thank you.
We're talking about vaccinations in general, but some specific stuff in terms of public health as it pertains to vaccinations. I don't know who to go to first with this question, but I guess what is the theory behind how a vaccination is supposed to work? Why we should have vaccinations?
Well, I can start with that. A vaccine is like showing your immune system a most wanted poster. It introduces your immune system to what a germ, a virus, or bacteria is going to look like. So your immune system can go through all the steps it needs to recognize it, so when it sees it for real, it's ready to go. It doesn't have to go through those initial recognition steps, and that gives the immune system a head start. It can either prevent the infection completely, or it can help the body have a head start enough to keep it from being a severe illness.
And in terms of, I guess, immunizations and vaccinations for children, just years of science and practice and research have figured out these are the appropriate times for these particular vaccines to be used, right?
Right.
Yes.
And I'm glad to speak to that. Just for pediatrics, vaccinations have been the greatest accomplishment in public health in centuries. I mean, children, often people would have 6 to 8 children, and maybe half of those children would live to adulthood. We know that there's times in the lives where the children best respond to the vaccines, and that we know the combinations that they best respond to, and so we've made great headway. In 2000, we had eliminated a lot of infectious diseases. Unfortunately, over the years, you've seen a lot of people begin not to vaccinate their children, and so it's real important to kids that everybody get vaccinated, because we have, especially very young children who aren't vaccinated, who are around adults and other children who can, get infections and bring those things to them, and until they can get vaccinated, it's important that everybody get vaccinated to protect those kids. And that's the thing called herd immunity. And so that's what you're sort of seeing happening in the United States right now.
Yeah, let me touch on that theory a little bit there, because it is, if you do it in piecemeal fashion, then there's too much susceptibility to populations that aren't covered by that. That's why everyone needs to participate in the vaccination process, right?
Yes. So if there's a susceptible person in the community, they may not be exposed to disease as everyone is vaccinated. But if there are a lot of susceptible people, it's easy for the disease to get passed around.
And that's why we've seen basically a resurgence of measles. I know there's been a big measles outbreak. Where did, I guess, if you can answer this question, where did the thought process come from that I don't want to vaccinate my kids anymore? I mean, is it religious belief? Is it lack of understanding of the science? Is it what do you think is driving those decisions?
What I see, and I think what generally people are seeing, is that vaccines are sort of a victim of their own success, because they've been so effective at reducing these diseases. At least in my generation, I'm 48. There's a lot of things like polio and certain, like Haemophilus influenza B, which is a really bad infection of the brain that people just haven't seen. I mean, some people haven't even seen chickenpox because of vaccination. So they begin to think that it's safe, that these diseases don't exist anymore. But of course, we live in this huge international world now. In just a couple hours, you can fly from one country, from one continent to the other, and that these diseases exist in a lot of places in the world still because of lack of vaccination.
Yeah, and we've seen mumps has made a comeback. I think there's an Arkansas school that has actually been shut down in Southwest Arkansas for a few days because of a mumps outbreak there. Let me draw your attention to this. I don't know if you guys saw this or not. It may make your eyes roll back in the back of your skull, but the Kentucky governor, Matt Bevin, this past week, basically in an interview said that he exposed his kids to chickenpox so that they would get it and be immune to it eventually. When you have a public official kind of making this type of statement, how does that affect what you're trying to communicate on public health?
Well, it's not an example we want to encourage people to follow. And unfortunately, he doesn't see the severe cases. People in the community don't see the severe cases of chickenpox. And of course, the children who die from chickenpox aren't around later on to say, you should have get the vaccine, because people think that it's a mild disease because that's all they've ever seen.
So when you look at chickenpox, when you look at measles, when you look at mumps, those are things that we did see some serious eradication of, but now we're seeing somewhat of a comeback. Is there anything else out there that you are seeing that is of concern to you?
Well, influenza. That is probably the vaccine preventable diseases that causes the most deaths. And people have unusual beliefs about the vaccine. Some people think it can even cause the flu, but medically it's impossible because the vaccine doesn't have a complete virus in it.
But what if you haven't had a flu shot in a couple of years and then you go get your flu shot and you are, I mean, because it's apparently it increases in its intensity every year. Is there danger in doing it that way?
I don't think I understand the
Well, I
question.
think, you know, a lot of times people haven't gotten a flu shot for several years. Of course, you get some exposure to flu viruses, but there's many types of flu viruses, and they change every year. Sometimes they mutate or their genetics change, so that like what she said, the warning picture of the virus doesn't look exactly the same as it did before, so the body doesn't recognize it as well. But I would still encourage someone to go out and get their flu. If they've had one in the past, it will boost what immunity is there, and it will also kind of be able to help their body recognize new viruses.
April, Chad. Do I have to go get a flu shot this year?
Well, you know, this year
Yes,
we've
yeah.
had a resurgence of flu, and we're still having a pretty heavy flu season right now. It takes a couple of weeks for the human body to develop the protection from the vaccine, but we're still encouraging it because we're still at a heightened flu season right now. We have widespread flu in Arkansas right now.
Yeah, I was in clinic this week and had several positive flu A's, so it's still out there for sure.
All right, so we have not really seen any activity from a public policy, a legislative perspective in this legislative session. I think there has been some to encourage access to vaccines. We haven't seen any kind of attempt to curtail vaccinations from happening, which is a good thing, I think, for Arkansas. But you do see it in other states. I think as many as 20 other states have had some sort of activity on this. Are you worried that that may come to Arkansas at some point in time, or do you think the public health sector here is strong enough to, for lack of a better word, resist that type of direction?
Yeah, I think we definitely continue to kind of watch what's going on in other states. You know, and despite some of these outbreaks, you see some states, you know, starting to remove some exemptions. Some have religious belief and philosophical exemptions, and you see a lot of states trying to roll that back, whereas you have some states who are kind of moving their exemptions forward. So it's sort of kind of watching what's going on, what the flavor. We're always particularly what's happening with the surrounding states. And but I think a lot of the activity right now in that state has been to improve access, which has been a good thing to make vaccines more readily available. It's certainly a big barrier to a lot of families getting vaccinations.
I'm going to give you the last word, Jennifer. I'm going to let you tell people where they should go. What should be the protocol if they've aren't sure where they stand with some of their vaccines for their kids or for themselves?
Well, they can contact their medical provider or the health department and get a list of what vaccines they've had for their children. We have a state registry, and they can check that. They can go to any local health unit for vaccines for children, and there are many pharmacies that vaccinate for older children, as well as clinics around the state that provide it for the kids.
My kids don't like shots. Guess who gets to take them to the pediatrician every time they've got to get shots? My wife puts it on me. So, Chad, Jennifer, thank you both very much. Good to be with you. Thank you so much.
Thank you.
All right, good to see you again.
Good to see you.
All right. Thank you for tuning in. That's all for today's Talk Business and Politics. I'm Roby Brock. We'll see you next time.
You'll find us at the end of a lot of long country roads, covering over 60% of the great state of Arkansas. Our 17 electric distribution cooperatives are working day and night to provide reliable, affordable power to over 500,000 homes, farms, and businesses, just like yours. The Electric Cooperatives of Arkansas, your local energy partners.
Each day, the promise of our nation begins again. Arkansas and America, moving forward. I help make that promise a reality. It's not for everyone, but people everywhere depend on us.
Oh, I love you too, sweetie.
Trucking delivers, or everything stops. And that's what drives me.